Greetings and welcome back to the Health Scholars channel. Today is day 4 of a series I'm calling CAREERMAS, which I'm reviewing the top healthcare positions for healthcare managers, administrators, and public health professionals. If this is your first time tuning into the channel, welcome. My name is Dr. Orobosa, and I'm super excited to have you here. Now, today we are going to talk about nursing home administrators. And really, this conversation is dedicated to professionals who are interested in the healthcare management or administration space. And you're going to know why as I go through the conversation today. However, before I jump into the conversation, here's a few words from our sponsor. Greetings, health scholars. Today's episode is sponsored by my course, which is titled From Healthcare Graduate to Hired. Are you a professional looking to work in the healthcare industry? Or are you a current healthcare professional looking to pivot into a different sector of the healthcare industry? If you answered yes to one of the two questions I just asked, guess what? This course is right for you. In the For Healthcare Graduate to Hire course, it is a 90-minute video program. So yes, I kept it short and sweet, but I've loaded it with a lot of information, including give you a detailed strategy, as well as actionable steps for implementation that will help you go from healthcare graduate to job seeker to hired. In addition, I'm sharing my experiences of working in various healthcare positions, as well as the strategies I have given over 100 plus professionals that have helped them land their first, next, or even dream healthcare job. Now, what can you expect inside of the course? We're going to talk about everything from preparing your job hunting strategy down to finding the right healthcare job for you. In addition, I'm giving away a few course bonuses, which includes access to an exclusive recruiter directory. So we're giving you the name and contact information to healthcare recruiters who you can work with to help land your next healthcare job. In addition, you're going to get access to the For Health Scholars job board, as well as a live Q&A session with me, Dr. Orobosa, to answer any questions you may have. So I hope this sounds good to you. And if you are a job seeker who's been applying to healthcare jobs within the last 6 months without any response, guess what? This course is right for you. To sign up, you can access the link in the description box. And if you have questions, you can also contact me at forhealthscholars@gmail.com. I hope this is helpful, and I look forward to seeing you in the course. All right, so we are back. And as I stated, today's conversation is all about nursing home administrators. And this can be a career option for you if you are a healthcare administrator or a healthcare manager. So let's jump into it. Now, one thing you must note is that the aging population, they are getting older. And as a result of the aging population getting older, there's also an increased demand for long-term care facilities. Now, one thing that we know is definitive of life is that things are going to change. And the circle of life includes us getting old. And for the aging population, at times you may need assistance from a long term care facility like a nursing home, an assisted living facility, an independent living facility, senior housing. And so today we're going to talk about the role of nursing administrators. Now, what is a nursing administrator if you're not aware of this role? Well, this is an individual who's responsible for managing the business and clinical operations of long-term care facilities, including nursing homes. So there are a variety of types of long-term care facilities, and nursing homes are just one, but they're the most popular one. I used to work in a nursing home, and I was a program manager for a nursing home for about 4 years. So this is up my alley. So I'm going to give you everything that I know about being a nursing home administrator. Now, do note, nursing administrators are not the same as nurse managers, supervisors, or directors, okay? This is not a clinical position. You may hear of nurse managers. These are registered nurses or nursing professionals who operate in this role. But a nursing administrator is specifically for the aging population, specifically working in long-term care. As a nursing administrator, here are your areas of focus. In your role, you may be responsible for personnel management, legal issues, and compliance. This is a big one. I'm going to talk about that shortly. Gerontology management. So that's the official name for the aging population, geriatric patients, or gerontology is the practice. Financial management. So the revenue part of the nursing home, insurance and managed care, especially with CMS. So the Centers for Medicare and Medicaid is definitely the insurance company that you're going to be dealing with the most at a nursing home. They do have private insurances and some are self-pay, but in the long-term care facility, it goes without doubt that you'll be working some way or somehow getting a report or even have to do things for CMS in order to get paid as a long-term care facility. And if you're not sure what CMS is, once again, it's the Centers for Medicare and Medicaid. Then you have housing as well as community-based services. Now, the nursing home that I worked in was based in New York, and they offered a continuum of services for the geriatric population. And so they did housing, they had traditional nursing home, and they had assisted living, they had independent living, they had community-based services. So I was a program manager for their community-based service, which was called case management, and all patients were private pay. So it gave me the ability to use my skills as a healthcare administrator, because at that point I had my master's, to be able to run a program. So tomorrow's video, I'm going to talk in detail about program managers, but today we're doing nursing home administrators. And so you may be wondering, what is the difference between practice managers and nursing administrators? Because yesterday I talked about practice management. Some of the key differences that I know between the two roles is the employment location. So for practice managers, you're usually working in an outpatient facility, but nursing administrators, you're working in some type of long-term care facility. You may have to complete a licensure exam. So to become a licensed nursing administrator, there's a licensure exam that is given by the state, and then they have a national exam. And I'll talk about that shortly, and the type of clientele you serve. As practice managers, you have the ability, and depending on your facility, you may work with clients from the age of 0 to 100. But as a long-term care facility, as a nursing administrator, your clientele is really the geriatric population, so those who are aging. So as nursing administrators, you are required to have great management skills, great leadership skills, and regulatory knowledge. Trust me, it is definitely important to understand the law, especially as it relates to managing the geriatric population. And so some of the common job positions that you can find this kind of role in can be nursing administrator, it can be an extended care director. So this is the interchangeable terms that they are referring to as a nursing administrator, director of nursing administration, and as it relates to long-term care. Okay, because you may have a director of nursing in a hospital, but director of nursing administration really leads to the long-term care side. So I just want to clarify the two, just in case, like, nursing, are you sure? Just so that we're clear, talking about long-term care nursing administrators. So what is the job description of a nursing administrator? So here is a typical position summary. And so they expect from this organization, a nursing administrator, to be able to plan, organize, and direct patient care in its extended care facility, which is usually a nursing home, long-term care facility like assisted living, or because assisted living has some nursing services, independent living, not so much. These people are usually older, they can live on their own, but sometimes they may need some nursing care. Plan and coordinate and manage nursing care. So although you are not a nurse, as a nursing administrator, you may be responsible for managing nurses. So these nurses can be RNs, they can be LPNs, they can be patient care techs, they can be, nurse practitioners to a certain extent. If your nursing home has a provider component to it, so the nursing home that I had worked for, they had physicians on site, they had nurse practitioners on site. So it just depends on your facility and what they have been licensed for. You're responsible for performance management. Budgeting is a big thing, staff development. And then, of course, you provide leadership and guidance, develop, implement, and enforce different practices, policies, and procedures. Sometimes you may even be responsible for writing policies and procedures. And so having regulatory knowledge is important. Now, the qualifications for a nursing administrator, at minimum, you can have a bachelor's degree, but usually they want you to have a master's degree, and you have experience in long-term care. You have a minimum of 5 years of management as a nursing administrator at times. It could be less, it could be more. Knowledge of Medicare and Medicaid. Once again, very heavily a part of the reimbursement side of the nursing home. Most long-term care facilities, if you're applying for a nursing administrator role, they prefer you to have a nursing home administrator license. Now, employers usually hire nursing administrators who also have a clinical background, and acquiring a master's of health administration degree can help you meet this requirement. And the reason why is that with an MHA degree, most of the times you have some type of internship or externship component. And that means you have to go into the field. And being in the field, you have to do a certain amount of hours to help support you in getting your degree. And those hours require you to be in some type of facility, whether it is an outpatient facility, inpatient facility, or a nursing home. Now, when I did my internship, I had did it at a nursing home, not the one that I had worked in, but I got my hours there. And so I think that helped me land the job that I got at the nursing home, which I want to just take a moment to discuss. So for those of you who are in a master's program and it requires you to do some type of internship or externship, this is the time to help you gain experience in the healthcare space if you don't have it. So if you're doing an MBA with a healthcare management concentration, then you should aim to do your internship, if your school requires it, at a clinical facility like a nursing home or outpatient facility in healthcare, even insurance, just something of healthcare. And that helps you with gaining experience. Gaining experience doesn't always require that you work somewhere. It could be places through your internship, but you just have to know how to leverage the experiences that you gain in your internship to make it applicable to being qualified for the role that you're applying for. But keep that in mind. So a MHA degree can help you gather that clinical experience. And now that I'm thinking about it, that's probably really what made me advantageous to working at the nursing home, and that they hired me. So in my role, I was the first program manager that they had for this specific department. And so it was really relying on me to implement practices to help that program come out of the red. So when I worked for them, they were in the negatives. And so I had to come and clean up shop a little bit. Pretty much a lot of it. Okay. And that required me to work with the finance team and other departments within the nursing home. But for nursing administrators, you may have to do the same thing. You may have to help a nursing home if they're in a deficit, get back into the green or maintain being in the green, or even just to break even. So there's some financial components that you may be responsible for as well. If you are interested in working in long-term care and you're interested in becoming a nursing administrator, I highly, highly recommend that you go for the nursing administrator license. It's great to have if that's the career path that you want to embark on. Now, to get the license, you must have at least a bachelor's degree. Most BHA or MHA degrees is preferred. Take and pass the National Association for Long-Term Care Boards. That's the national exam. There's alternative is you can do the state exam, but with the state exam, you can only be licensed for that state. So if you move to another state, say for example, you got your license in New York, but you move to New Jersey, because you're a commuter, and then you finally was like, okay, let me work in New Jersey. In order to use your license, you would have to get the New Jersey license, whereas the national boards, it's across the board. So just keep that in mind. The exams are pretty affordable. Like I know the national exam is about in the $400 range. The state exam is cheaper. It's about in the $100 range from the last time I checked. Okay, so it really depends on your finances and your goals. But if you can take the national exam, that is something that I recommend. But if you just want to get licensed and you don't have the funding for the national exam or the time to study for the boards of the national exam, the alternatives is to take the state. So you only focus on learning the state regulation, and it's cheaper. Now, what is the typical salary for a nursing administrator? So this is the higher position, and so you may get higher income. You can even get six figures working as a nursing administrator. Across the US, the average pay is about $98,000, but it makes sense. You have a license, you have your master's, or even at bachelor's, you're managing a full facility. So the salary price point makes sense for the average. If you have anywhere from less than a year of experience, it's still a good starting point, about $80,000, and 10 to 19 plus years of experience, $120,000 or more. And once again, these are just according to the average. This is from salary.com. But depending on the state that you work in, depending on your negotiation skills, depending on the budget for the organization that you're being employed for under the nursing administrator, your salary can vary. But I would tell you, aim for at least, if you new to it, less than a year, Here's your average, aim for 80, 85. Have some experience. These are good salary ranges to consider if you're negotiating salary or getting a position as a nursing administrator. So keep that in mind. Now, the types of healthcare organizations that hire nursing administrators, so of course, nursing homes, assisted living facilities, and certain nursing homes may have an assisted living facility, some do not. I had worked for a nursing home that had a continuum of care, so they offered everything. So it was like a one stop shop facility, and they were really impactful. So I enjoyed my experience there. It taught me a lot about being a program manager, and from that role, that's where I transitioned into academia. Also, independent care facilities and gerontology management firms may help you, case management firms as well. As a nursing administrator, you are also going to work with social workers. Nursing staff, social workers are like your top two clinical. Well, social workers are not clinical positions, but they can become licensed clinical social workers. Those are people that you're working with in addition to administrative staff in the healthcare space. So this may be a right position for you. If you like, this is something interesting to me. I may want to look further into becoming a nursing administrator. I will just tell you that this role will be right for you if you have great problem solving skills, analytical skills, legal knowledge. This is important, very important, especially working with CMS, the Centers of Medicare and Medicaid. You have to be on point. You cannot break the law. Another place you can also work is these staffing agencies. So home health agencies, that's what I meant to say. Home health agencies is another place that you can work. And then of course, having great multitasking skills if you want to become a nursing administrator. So I do hope this video was helpful. Once again, thank you so much for watching day 4 of CAREEMAS. Make sure to like, subscribe, and share this with somebody who you know needs it. And until next time, bye for now.